Hi, I'm Ben Dean, presenting on behalf of the Corona Hands Collaborative. This is our project looking at mortality and pulmonary complications in patients undergoing upper extremity surgery at the peak of the pandemic in the UK. Little was known about the real-world risks to patients of undergoing upper limb surgery at the peak of the pandemic. Our aim, therefore, was to assess the risk of surgery at this time point, the primary outcome measure being 30-day post-operative mortality. Our secondary outcomes were coronavirus-related complication rates and the overall complication rates. We recruited 74 centres from around the UK and included any patients undergoing any form of surgery below the elbow from the 1st to the 14th of April inclusively. So, the vast majority of our centres, 72 of the 74, 97%, had stopped all elective practice. The majority, 71 centres, had used pre-admission coronavirus screening questions. A majority of 73% were not using coronavirus testing before surgery at this time. And the practice in terms of face mask use by patients, personal protective equipment used in surgery, and the handling of positive cases was highly variable. There were 1,093 patients in total, 698 males and 395 females. Over 86% were adults, the mean age of 42. The majority of the upper extremity surgery was urgent or expedited. The most common indication was trauma in 88%. Infection was the second most common indication in 8% of patients. Local anaesthetic alone was used in 52% of cases, regional anaesthetic in 18%, and general anaesthetic in 32%. The key take-home finding from our study was the very low complication rate relating to coronavirus at 0.18%. These were two pneumonias. One was mild and treated on the ward, and the other was fatal. Notably, the fatal pneumonia was in a patient who was originally admitted with the pneumonia and then over a week later in hospital developed a bacterial hand infection. There was zero mortality for patients admitted on the actual day of surgery. The overall surgical complication rate was 6.6%. The most common complication was surgical site infection in 33 patients. The risk factors for surgical complications were increasing age, surgery being done for infection, and surgery not done under local anaesthetic. So overall, we found a very low coronavirus complication rate in this cohort of patients, with zero mortality for patients admitted on the day of surgery. We would conclude that urgent surgery should not be delayed pending the results of coronavirus testing, and there are other significant implications which we discuss in our study's discussion, which you can read in full in the BMJ Quality and Safety journal. And finally, a massive thanks to everyone who's contributed to this project. You all know who you are. It's taken a lot of motivation, time and commitment to get this done within a relatively short time frame. Thanks a lot for your help.